Start, yeah.
Hi, welcome to our falls prevention webinar. I think it says Nicole Cook up there, but I'm actually Mandy Meehan. So today we're going to introduce the concept of falls prevention with a healthy aging lens and having a look at what you guys can do to help your clients and participants prevent falls and experience health and well-being in later life. And just to note, there'll be a bit of time at the end for some questions. But before we start, I'd like to acknowledge the traditional custodians of the land we are meeting on today, wherever you may be, and pay my respect to their elders, past and present. I extend that respect to Aboriginal and Torres Strait Islander people joining us here today. So a little bit about me. I'm a born and bred Sydney gal, and I've relocated to Melbourne from the Northern Beaches on Sydney. Most of my career, in fact, pretty much all of my career, has been working alongside people living with a mental illness. And I've had various roles, predominantly in both community and hospital public mental health settings. I'm quite passionate about improving the health and well-being for middle-aged and older-aged adults experiencing mental health challenges. So where did I get into falls prevention? So it was way back in 2013. And I was working for a mental health for older persons service, and we had a group program called The Studio. And we noticed that a lot of our older clients were falling. And I'd come across a falls prevention group in New South Wales called Stepping On. And I thought, oh, let's bring that into the group. However, I ended up doing a train the trainer and embarked on multiple presentations looking at trying to raise a profile of falls prevention in mental health, and that sort of culminated in a research project. I've sat on many falls committee, both at the mental health and district level, but I was really privileged to be a member of the New South Wales Falls Prevention and Healthy Ageing Network Advisory Committee. Then, a couple of years ago, that all came to a head when we moved to Melbourne. Hubby got a job down here, and with an eldest starting year 11, it was Victoria or New South Wales. So literally we arrived in Victoria the day before school started. I had a little bit of a commute back to Sydney and then enjoyed 6 months of long service leave before I started here at Empower, and it's already been 12 months. So our Empower family spans across Australia. We're in Victoria, New South Wales, Queensland and WA. We have multidisciplinary teams of allied health professionals, and we look to endeavour to make sure that we provide the highest quality comprehensive care for our clients in the home care space, our participants in the NDIS space, and of course our residents in aged care facilities. So as you heard, I'm very new to the home care package and the NDIS space. And I thought it was quite fitting to share a story of one of my first clients that I saw for home care. So a referral came in for an OT assessment for rails in the toilet and the shower, as this client was having some difficulties. This client was only in her early 70s. Had a recent fall and a hospital stay. She was a little bit deconditioned, lost a lot of confidence, and was feeling quite down because she wasn't going out and meeting up with friends. She wasn't able to had the confidence to go for a walk. And I thought to myself, rails? Oh my gosh, you're too young to have rails. We need to work on your confidence. We need to work on your strength and your balance. We need to have a look at a falls prevention and healthy aging lens, and we did a lot of that falls prevention. We looked at some simple strength and balance exercises, how to prevent her fall in a home environment. It was a lot more sort of all-encompassing, and I hope that it helped her with a bit of more healthy living. So why do we talk about falls so much? Falls are actually the #1 cause of hospitalised injury and injury-related death here in Australia. So if you're over 65, you're more likely to be hospitalised or die from a fall compared to other life stages. The older you get, the higher the risk of hospitalisation. This data comes from hospitalised falls, so only people that are presenting to hospital post-fall. We don't track really well falls happening in the community. It's really hard to try and capture that data. So the question is, how many other falls are not being reported? And for many of you working in the community, it really sort of ties into how can we help our people? And as we said, 5 in 10 hospitals occur in the home. And that's compared to residential aged care facilities. And I guess when you think about it, it makes kind of sense for those working in that space. There's a lot of guidelines around how much staffing, what your observation levels, we've got equipment, we've got modifications. We're real set up in that space. But at home, it's not kind of the same standards. There's not the same guidelines. It's really up to the individual, maybe their family and their supports to assist. So when we're thinking about all those falls that aren't captured, you start to wonder how this issue really is. And I guess many of you have probably come across where you might talk about people about, have you had a fall? And say, oh no, dear, I haven't had a fall, but they're all covered in bruises. They might have, and they call it a slip or a trip or a stumble. They don't call it a fall. There's a lot of fear of reporting about falls. There's fear of losing independence. There's fear of, the daughter-in-law wanting to put them into a residential aged care facility. If you keep falling, that'll be the last thing. There's such a lack of confidence. And I think this is where we can work with. So I guess we need to know the risk of falls. What are the risks of fall? And you can see from the word bubble, there's quite a lot. So in Australia alone, 30% of adults aged 65 and over will experience one fall a year. But falls can occur throughout the lifespan. And I know from my work in New South Wales, we looked at some special risk factors for different populations like Aboriginal Torres Strait Islanders. And also the research and the work that I was doing was on people with serious mental illness and having a look because they were falling a lot earlier with all their comorbidities and other risk factors. So we in New South Wales and in our services, we actually started screening from the age of 50, not 65. So I guess it's important to know that falls risk is multifactorial. It can be linked into changes of physical sensory function. The use of medication, 4 or more medications increase your risk of falling, and you can imagine how many older people are on 4 or more. People often don't have just one risk factor in that little bubble, and falls risk will escalate as the number of risk factors increases. So when you think about my little lady that went out to look at the rails, so that really affected her depression and her anxiety. It impacted on her fear of falling. She stopped doing things. She didn't go for walks. She was so frightened. Then when you start to sort of get a lot of social isolation because you're not going out as much, and that can affect your cognition. And you can see how all this sort of interplay in that falls risk. But I want to bust some myths today. I want to bust the myth that falls just don't happen to older people, and falls are not an inevitable part of ageing. And it's quite interesting that we're in the United Nations Decade of Healthy Ageing. But what is healthy ageing? It can be a little bit misleading. We talk about ageing well, optimal learning, productive ageing. Is it successful ageing? What is it? And I think it just goes back to the definition. Because healthy ageing, is not just the absence of disease. And if you think about my little lady with the rails, it's a process of developing and maintaining functional abilities that enable us to experience well-being in older age, and it's about creating the environment and the opportunities that enable us to do and be what we value. And I think by doing that more holistic approach, we're trying to address some of those issues. That little diagram comes from the New South Wales Falls Prevention and Healthy Ageing Network, and it's about the 5 pillars of healthy ageing. And I think it really just goes to show that it is more of a global approach to falls prevention. When you're looking at some of the things that falls can be prevented, that is one of the messages. Exercise has been shown to reduce the number of falls over time by 23%. particularly if you're looking at balance exercises, that can increase up to 40%. And multi-component and multifactorial interventions that you see on the screen there, they've also been shown to reduce the risk of falls. This little infogram is from the World Health Organization, and it's their guidelines on physical activity and sedentary behaviour that was drawn up a couple of years ago. This is particularly for older people. And you can see where this link is with healthy ageing, being active, and how it prevents falls. Looking at physical activity, walking, strength and balance, these are all sort of the things that can impact. As we get older, we're less active. Sometimes if we've got a disability or circumstances around that, we can be less active. And don't even get started on the impact of COVID. When you look at an older person, and you can sometimes you see with their head stooped, it's a bit hard on the screen but I'm sure many of you have seen it, because they're looking at the floor, they're fearing of tripping on something. They're a little bit wobbly, so their feet are a little bit wider, and then they start to shuffle. And this is where you get a lot of falls. So what I see we wanted to do is to lift that posture, give people confidence so they can look out and experience the world and smell the roses. There's a thing called sarcopenia. And Professor Sue Curl, she was working in Northern Sydney where I worked, and some of you might know her from the ABC series, Nursing Homes for 4-Year-Old. She talked about this concept of sarcopenia, which is a progressive and generalised loss of muscle mass and strength causing functional problems. Sometimes it's unrecognised. We can easily pick and identify someone who's frail, thinking they've got skinny little arms and leg, no muscles. But actually, the muscle loss can be replaced by fat and connective tissue. So some of our people that are a little bit less active but might be overweight, they can have some issues that impact on their function. And for all of us, this is a scary fact, every one of us will lose approximately 1% of muscle mass every year from the age of 30, more after 75. It doesn't matter if you're an elite athlete or if you're a Netflix sitter on the couch, we all lose it, which is why we should be really having a more holistic approach and referring on to physiotherapy and exercise physiotherapy to target some of these issues. As an occupational therapist, I think this is really exciting. There was some research by Professor Lindy Clempson, who's an OT in Sydney, that looked at all the different falls prevention type of activities. And it's looked at occupational therapy home hazard reduces falls by 38%, which is quite significant. And I think it's where, I've gone too far, sorry. And I think it's where we have that really good lens to have a look at the whole person's environment and the whole person's being, and making those hazard assessments a comprehensive clinical assessment, getting people to remove those mats and cords that are causing trips, some of the equipment like rails, and just providing a little bit of that education. And that helps with the falls prevention. And I think we're also equipped to help out with the healthy ageing, looking at the overall function and ADLs, and ensuring that a person's home, because remember it's the home where all the falls are happening, we're ensuring that their home is safe and unlikely to cause falls. So how can we prevent falls? So Professor Stephen Lord, he's from Neuro, and he presented at the New South Wales Falls Prevention Conferences every year, and he talks about the gold bar evidence of falls. And we're looking at things like balance and strength. This is something that your Empower physios can help out with, looking at individual falls plans and interventions, comprehensive assessments for your OTs. And I guess the OTs are quite well placed as well, if you're a little bit unsure yourself, is to pick up some of those problems with feet, medications, continence. And we've got the benefit of being able to do some referrals to our team here for the rest of the allied health to get that comprehensive intervention. What we've done is we've just got a little bit of a table here. So if you forget at a later date, will be available on our website, and we've got a falls prevention blog, and it will just list all those multifactorial interventions. So I guess the recap is, what can we do? one of the things which is really important is screening and assessment for your falls risk. There's a FROPCOM community falls tool, which is widely used. I've heard some home care package people have a lot of space to do that, but our empowered OTs can help out as well as those comprehensive assessments and referral on. We've also put this on our blog too, which is a beautiful chart from the Clinical Excellence Committee. And it just actually goes through when you're doing your screening, what type of interventions, and we've highlighted in blue who to refer to as well. So there's many ways that you can go in and link where you want to refer. So I guess we're here to help you. So you know where to refer. On our website, we have our service coverage and some maps, and we also have relationship managers in each of the areas that you can touch base. And we look forward to working with you and helping all your clients to achieve their goals to be healthy individuals. So I guess we've got some time for questions. So what we want to do is if you put them up in the comments section or raise your hand, and I'll see if any questions come up. So the first question I can see in the chat is how much of a difference can wearing the correct shoes make? Huge difference. As an OT, I can see, and in Australia, gosh, how many old people wear thongs? How many of us wear thongs? They're just not supportive, and which is why I think it's really important to go through the shoes. That stepping on program that I talked about, one of the issues, one of the components was a whole session on which covered footwear, providing that support around your heel, making sure that somebody could feel the ground, but being supportive. And then if you think about people with diabetes and peripheral neuropathy, it's really important to refer on to your podiatrist to make sure that you've got the right footwear and you've got the right foot health. Do you service the Mid-North Coast? I think we'd have to go to the map for that, but we'll get back to you. Narelle? Are you able to share the slides with us was the next question. Yeah, Melanie, we'll put them up on the on our website. We've got the falls prevention blog and the slides will go up there so you can refer to them after. And again, I guess with the Bathurst Orange region, a lot of those questions will come up when you look at the maps on our site. Being a 12-month in newbie, I'm not quite sure of all of them. A lady with a hand up.
Annette Brown.
Annette Brown. That was the cover. Oh, sorry. Gosh, there's more. Apologies, I'm not scrolling down. Can we access Empower Physio after hours? I think we're just during business hours for most of our services. Karen? Barbara's asking, are you able to share as an evidence-based falls risk screening tool? We might put the link up for the FROPCOM. That's the one coming from New South Wales Health. That's the one that is used widely across both inpatient and community settings. It's really easy to administer, so we can put that up on the... It's already on the blog. Thought about that already. How many falls do older people have on average? What's considered a lot of falls? I'm not quite sure what the average is. I think it's particularly about how many falls. I think it's about having a fall. I think it's about getting in there first, preventing the falls, because once you have a fall, you're more likely to have more falls. The more falls you have, the less confidence, the less you do, the more socially isolated you might get. It's just got huge trickle-down effects. So I think the first thing when we're thinking about that is to get in early, see what we can do to prevent falls, And then what can we do if somebody's had a fall, just to make sure that they get appropriate medical follow-up, and we have a look targeted interventions that can really relate to what some of the impacts of the falls. And a lot of the time is that when you have that comprehensive OT assessment, that will cover that. And that FROPCOM flow chart that we had on the slide too, that will have some as well. So the next question is, do you see a role in falls prevention for innovative technologies like in-home radar monitoring for behaviour trend analysis and instant alarming for adverse incident occurrence? Every year I go to the New South Wales Falls Prevention Forum, and you often see all these wonderful little innovative sort of tools and technologies and research that's been presented and going on. A lot of the New South Wales Falls Prevention Network will have a lot of those resources and talks up on their webpage. But yes, I mean, this is the way we're going, isn't it? There's already some fall sensor alarms that you can put up in a person's home. Sorry, I can't think of the brand, but they detect movement and you can place them in certain places. So like, I'm going to put one near where Dad's medication is, and I'm going to set a timer. And if Dad doesn't pass this beam, it's going to alert me as a carer to ring up and say, Dad, have you had your medication? So there are definitely some uses of technology already. How does incontinence affect balance? I'm not quite so sure about the incontinence and balance, but it's more of a, from my understanding, it's more of a contributor to falls, because particularly for people that might have urge incontinence, and they've just got to get to the toilet quickly, or because of their prostate that's enlarged, they're up all night, and there's a lot of environmental risk that they might trip and have a fall on the way to the bathroom because they're half asleep. Obviously, if you can't manage your continence, that can impact on your independence and risk of falls. And your nurses, yeah, of course, our nurses here are very good with continence assessments as well, and that can help. That's why that's one of the good things for falls prevention. How much bearing does dementia have on increased likelihood of falls? I think cognition, both dementia and delirium, are big risk factors for many things, and falls is one of things, because sometimes you can help someone and educate them and make them aware of the risks and work with some intervention strategies. But if they don't have that cognitive capacity or that ability to remember, then this is where it comes a little bit challenging to try and change some of the risky behaviours. And I think that's why people use things like falls mat and falls alarms. Is it possible to expand on the education you provide to your clients? Oh, Karen, I'd love to be able to do that. I'm not sure if you're meaning from the empower point of view, but yes, I think there's a lot of scope to be able to provide some specific falls prevention interventions. And the last one I've got up here is, do you have any tips on falling well if a client is scared of falling again? So of course, we want to avoid it. One of the things I do when I see a person is teach them how to get up after a fall. And on the Clinical Excellence Committee, there's a lot of commission site, sorry, there's a lot of really great resources, and one of them is how to get up after the fall. And something that we often teach people is it's not ideal to lie down for long hours until somebody gets you, because you've got a lot of risks of complication. You get chest infection, it just delays everything. And if you're a bit old, or you've got older, or you've got a vulnerable brain, it just means your recovery and your outcome can be a bit changed. So we teach them to sit up and how they can get up and how they can get some help. And I think that's really important. I think that's all the questions that are coming through. If anyone else has got something else, how are we going for time, Nick? If there's no more questions, I will just, sorry, I'm going across to screen and my mouse is being a bit recalcitrant. So before we go, I guess just as a little reminder to get onto that falls prevention blog page on the Empower website, and that's where you can look at a lot of the resources. But also we've got some more exciting webinar series coming up for 2024. And the next one will be on the 28th of Feb, which is all about chronic pain. So there's a little, if you want to do that now, you can scan on your screens right now and register for that webinar. So I thank you for listening, and we look forward to working with you and helping your residents, your clients and your participants really try and reduce their risk of falls and improve their health and well-being. Thank you.